Hey there, how you doing? If you are a private practice health practitioner, so you can be a dentist, a chiropractor, a naturopath, functional medicine, nutrition, you name it, and you have great clients, you have great patients that you want to do more for, and you're kind of hung up in the money talk, is what I'm calling this one, um, where you're trying to get them to the state of health and to the desired location they want to be, but we're hung up on talking about the money and the hangups in several spots about this. You're going to want to stick around for a few minutes because I'm going to break this down into a tutorial and something to get you thinking, and also as a resource to moving you forward on growing your practice to keeping and getting more of those clients you want to get. And so this is for you. Hey there, we have not met before. Like I said, I'm Dr. Ginger Bratzel. I have been helping healthcare practitioners for over 20 years. We did this math in all areas of healthcare to get and keep more of your ideal patients and clients. And so in my career, I started out in dentistry. This is where highly insurance driven, low income area. And it's like, how do you do the type of dentistry you want to do? How do you do the type of healthcare? How do you do that? How do you help clients the way you want to do? And so it was always coming back to this money talk. And if you've got people breaking appointments or not following up, or they say they can't afford it, you've got a money talk situation. So this is really relative to you. So I'm going to break this down, and I'm going to grab some glasses so I can run my computer here, and really share this with you as we make this, make that a little bigger, and talk about the money talk. So on the money talk, here's the big thing. So even if you are what you're doing now, even if you think you've got a great person in there talking about money, or you're always looking for the great person to talk about money, and it might even be you if you're a solopreneur or a solo practitioner, the presenter's money beliefs and attitude have more to do with the success of that than the patient or client. And that's worth noting again. Your person who's talking about the money and bringing up the money, it has your attitude has more to do with it than if the person on the other side. If you're sitting there you are sitting there prejudging them if they can afford this. You've got the tensions of your life is going on. You've got 6 other people and phone calls and emails you got to go, and you're trying to just zoom through this to go through the nuts and bolts. It is getting to you. It's going to catch up with you. So your luggage and your baggage that you're carrying around is what's slowing you down, and you've got to get over it. And I had this going on in my own practice, my own money attitude, but I can even tell you more than this. I had people if you have team members, employees discussing money too, or you hire someone who's really good, you think they're going to have some hangups. So we're going to talk about getting over that, where it's a win-win-win for everybody. You don't know this, but a lot of times you are prejudging them without even knowing. So they tell you they can't afford it, and you've already got that in your head. But let me tell you, people can't afford it. Now, how can I tell you? Well, because they probably have one of these that they walked in with, uh, you know, essentially $1,000 of electronics that they replace every 2 to 3 years. They came in a car. They went by Starbucks or got a premium coffee. They're buying good stuff. They go to Target. So yeah, they can afford it. It's just not top of consciousness and not on their priority. So you're sending out those vibes. I don't want to talk about the money, even subconsciously, and they're picking up on it, and they're going to regurgitate back to you, and they're going to say they're gone. So you're asking me, hey, Ginger, can you help me get better clients and patients? When the ones you've got are fine if you just redo it. In my own practice, when we reshifted this, I can tell you what kind of growth we got out of it that was tremendous. And like I said, it was happening in my own front door. So you have to shift the focus to make that happen. Shift the focus. So here's my lay it on the line, my confessional. I can give it to you directly. So we have all these great people. We went through money scripts. We went through templates. We went through all this training, and still we weren't getting it. And one of my best employees was actually my co-owner and worked with me in the practice, is my husband, now Mr. Ron. And Ron was fantastic. He's great on delivering care. He's great with people, everything like that. And you think he had a vested interest in making sure we were successfully, financially successful. It was his mission too. We were trying to treat people. And things weren't coming through. And so when we did this one shift in our practice where we talked about making a win for the practice, win for the person presenting the money, and a win for the patient, that's when things happen. So Ron, who was giving the money, he was doing clinical work, and he said, I'm going to take you up to the office coordinator. I'm going to take you to the office manager. I'm going to take you to the financial planner. I'm going to have someone else talk to you about the money. And then his hands were off. And they were picking up on that vibe. And this is what he was giving out. He didn't even know it. When we made this one shift in our practice where we're focusing on who was delivering it and how the treatment plan and how they're delivering it, it was a win-win-win for everybody. So Ron was fighting for his treatment plan. So if he had a patient in his room and he was talking to him, he was fighting to be the one to go over the financial arrangements. He was the guy who had never talked about money, wanted to talk about money. The patients were more likely to accept. The same people who just told us they can't afford it, it was a win for them because we put a win in it and we got more treatment done. Our no-shows dramatically decreased. Our broken appointments, because they were already invested, because we had actually people pre-paying for treatment gladly and willingly with this method. So if you would like the template, this is how I teach my private clients all over in healthcare about setting up financial arrangements and how to bring up the topic and how to go through it. I have a checklist that goes through, and then the walkthrough and how I make it a win for the person talking about the money, a win for the patient, the client, for them to get it so they can get the care they need, and win for the office. And so by product of that, I won. I had that all broken down. If you would just put in the comments or send me a direct message that says, let's call it money talk, I will give you that training that I do. I did it with one of my private clients. Well, I do it with all of them, but at this particular one, I did it not long ago. I recorded it. So I think you'll get great value for it. It's my pleasure to give to you. You don't have to give me your email. You don't have to do anything like that. Just put it out there, and I will just say the money talk, and I will send it over to you through Messenger, and you'll have it all there, and you can go through it and copy exactly what we did. And this system is just crushing it. I want you to have that resource. So this is my gift to you for just being out there and being able to have the resources you need. So give me that out there, and so you could actually implement it. It's so easy. You go through it. You could start this system tomorrow, and you can increase your case conversion, your collections, your prepays, and get rid of your broken appointments. 4 bonuses there for this one change. You've got to do this. So reach out to me, and you can have it and start on it tomorrow. Take care. This is Ginger. We'll see you soon.